are clearly mindful that within the young patients who have breast cancer, they may be BRCA1 and BRCA2 mutation carriers, and that's a different subset. Those are patients where we do know that patients who have breast conservation still have a breast and are at risk for then developing a subsequent new breast cancer. It's interesting that those patients, their tumors are actually very, very sensitive to radiation, so they do very well in terms of being able to treat the known breast cancer, but they're at risk for developing more breast cancers. And those are patients that I think it's very important to bring the genetic counselors in advising patients what's the best way to proceed. If you are a mutation carrier, BRCA1 and 2, and have an early stage breast cancer, I think being able to compare breast conservation and having with lumpectomy and radiation, and having discussion with mastectomy is very helpful in individualizing what you do. And for those who are very desirous of keeping their breast, we know that there are factors such as chemotherapy clearly helps to reduce the risk of a recurrence or a new breast cancer in those patients. And probably oophorectomy would be another factor that should be considered. So it's a complicated issue, and I think it's important to have the genetics people on board to help to advise that patient as she makes a decision how she wants to be treated.